I'm your host, Marsha Florence with Just Ask. Today, our show is the American Cancer Society. Hurry back and join us. Hi, I'm your host, Marsha Florence of Just Ask. Today, our show is the American Cancer Society, and our guest is the Executive Director, Donna Clark, and a volunteer of the American Cancer Society, Kimberly Batchelor Davis. Hi, ladies.
Hi. Hello.
Glad to have you on the show.
Thanks for having us.
Thank you. Now, the American Cancer Society, everybody knows the name, but we need to start off with you, Donna, and tell us about the history and your involvement with the American Cancer Society.
Okay, well, the American Cancer Society has been in existence for over 80 years, and our four primary reasons for existence is through research, education, advocacy, and service. So our job is to reach out to communities that we serve to educate them, not only on a national level by being a national voluntary health organization, but also by touching the communities we serve on a local level and the grassroots level to bring our services and programs to the communities.
Okay. Now, by it being so many different levels of cancer, is it overall, is the American Cancer Society concerned with all cancers, or is there a specialty division there or something?
Overall, we're concerned with all cancers. However, just with our limited resources, human and financial, there are certain cancers that we look to as being sort of priorities, not because they're more important than the other cancers, but primarily because these certain cancers affect more members of the population. Okay. And they would be prostate, breast, lung, and colorectal, as well as skin.
Okay, okay. And your role as the Area Executive Director?
My role as Area Executive Director is to oversee programs and services that we have here in Metro Detroit, as well as helping with some of our special events that we do. And I do some educational outreach programs for at-risk or medically underserved populations in the metropolitan area.
Okay, okay. Well, Kimberly Batchelor Davis, we don't want to leave you out. As a volunteer, Kim, tell us how you got involved and what do you do?
About a year ago, I was contacted by a representative from the local American Cancer Society asking me if I wanted to participate in the Making Strides for Breast Cancer, which is an annual walk that the American Cancer Society has every October. Well, I'm a big advocate of giving back to the community, and that was something that I really enjoyed. Well, shortly thereafter, someone sent me a questionnaire about some other activities that I could participate in, and I joined the Reach to Recovery group, which is a group that's set up by the American Cancer Society to help get the word out about breast cancer health, early detection, the Telefriend program, and to just basically educate women on what breast cancer is, what happens once you're diagnosed, and to let them know that there's a support network out there that is available to them.
Okay, well, that's a wonderful thing.
Thank you.
Okay, now the volunteers, are there numerous volunteers for all types of programs, or are you guys pretty much like one here, one there? How's the volunteers set up?
Well, I can speak about it from my end. There are several components to the volunteering angle. You can join under advocacy if you wanted to participate in the legislative side of it, if you wanted to work with some of the funding that's done through some of the programs, or if you wanted to do a more community grassroots approach, which is where I'm coming from with the Reach to Recovery program. You get to focus more on the individuals and working in the different communities that are underserved in some of the different areas that the American Cancer Society wanted to target.
Okay. Okay. Sounds wonderful.
Thank you.
Are there any other organizations that you partner with?
Actually, there are numerous. We have wonderful relationships with all the area hospitals here in Metro Detroit. We're doing some specific work with St. John Health System, as well as with the Providence Cancer Center. We do a lot of work with Access Community Services, working a lot with the Arab American populations. We're doing so much more with the communities, and we're doing a lot more partnering with community organizations because we know we can't reach our goal to eradicate cancer by ourselves, and it's all about collaborating and sharing a network of resources with individuals who are being touched by cancer every day.
Okay, okay. Are there certain minority groups or ethnic, well, I'll say minority groups as well as far as like male or female groups that you basically have to, you know, overshadow with your services because cancer might affect one group more than the other? Absolutely.
In general, cancer is a disease of the aging. So the older you get, the more likelihood your chances increase to be diagnosed with a certain type of cancer. That doesn't mean that a 30-year-old won't be touched by cancer, but the likelihood is greater the older a person gets. So, of course, being a disease of the aging, certain populations, older populations, typically 40 and over, are populations that we look to really spread our educational messages and services and programs. There are certain ethnic populations in which we target with our programs, particularly people of color, whether they be Latinos, Arab Americans, and African Americans. Cancer deaths and cancer incidence rates tend to be somewhat higher in many of these population groups, particularly mortality rates with African Americans as it relates to breast cancer is twice that of Caucasian women. So we have programs and services, and it's part of my responsibility to do education and outreach to those particularly communities who are at greater risk, as well as really looking at how we can help make an impact, change behavior, and really let people know there are services and programs that are free to them that are in the community for them to access.
Okay. Okay. Well, we hope here at Just Ask we can be some help to you because people, I mean, the fear of knowing that you have cancer or any type of disease whatsoever is enough to traumatize a person, but I don't think that the community at large recognize all the resources that are out there to support them, you know, when they go through life changes. So how do you ladies feel about when you find that there's, say for breast cancer, for instance, how does one increase the knowledge of self-breast exam or the importance of going to get a breast exam in the first place?
Well, one of the things we do is through our vast volunteer network. We only have a limited number of staff people here in Metro Detroit, so we can't reach 4.5 million people with this message. So fortunately, we have volunteers like Kim, as well as hundreds of other volunteers in the community that are trained on proper breast health. The Reach to Recovery program, being a specific program geared towards breast health, we have over 200 volunteers in the metropolitan area who are trained, who are breast cancer survivors themselves, who are trained to go out and talk with newly diagnosed breast cancer patients to help give that one-on-one support, that mentorship. A program we have called Tell a Friend, which is an early detection message that we give to women 40 and over about the importance of regular annual mammography. We have volunteers that are set up in faith-based organizations, in community groups, in corporations, in block clubs who are empowered to really bring that message to their communities that they live and work with every day, to let the women in those communities, in those areas, know that they can do something. And if they need to know how to do breast self-exams, we have tools and resources, as well as we go out to the communities and do workshops in places of worship, in community centers, at block club meetings, at sorority meetings, to train people on how to do breast self-exams and what is the proper breast health that they can have for themselves, as well as talking with their doctor.
That's great. So someone can call a church organization, a workplace can call and say, we would like for you ladies or a representative come and speak in reference to breast exams or cancer society information.
Absolutely, and the one thing that we're looking to do to expand our horizons and really reach the community we're trying to serve is what we're doing now is not just saying we have a staff person coming out to do that workshop or to train those ladies in the church, but maybe to have a representative or two from that church be trained by the American Cancer Society to say this is the proper way that you do breast self-exams. This is the American Cancer Society's guidelines. These are some tools and resources resources you can use. We train them to be trainers so they in turn can go back to their congregations, their sororities, their neighborhoods. So now it's not just Donna Clark trying to get to 5 million churches here in Metro Detroit, but having an army of individuals who are trained and empowered and educated to go out and to serve and train those persons within their own sphere of influence.
Okay. Okay. What about the male population? Is there volunteers for the male population when it comes to prostate cancer and things like that?
Absolutely. There's two primary programs that the American Cancer Society has put together. One is called Man to Man, which is a support group for men who are being diagnosed with prostate cancer. And that's open to anyone, and we're getting a few sites that are established around the metropolitan area. And so again, if anyone wants to know where the nearest man-to-man support group is, they can call our office. And another program that we're just getting started, and we're starting trainings in the next month for a program called Let's Talk About It. And it's actually a program geared towards African American men because, again, looking at the science and the statistics, African American men are at greater risk for prostate cancer than their white counterparts. So this Let's Talk About It program is a peer education program for men to understand what are their prostate cancer risks, where is their prostate, what does it do, and how they need to proceed by talking with their doctor, what questions they can ask. And again, we have a gentleman who works for the American Cancer Society who is doing trainings for everyday men to be able to go and talk in the barbershops, to be able to talk in their frat meetings, to be able to talk at their community meetings, to be able to talk at their union meetings, whatever it is, to be able to say, this is what you need to know, these are your risks, and you need to talk to your doctor and understand what your risk for prostate cancer. Okay. So those are just two brief examples of what we're doing to address the male population as it relates to prostate cancer.
Well, I'm sure the men will be very glad to know that, you know, so they don't think this is an all-woman thing.
Not at all.
Donna, before we take a commercial break, why don't you give us the phone number and if you have a website available for people to be able to contact your agency as far as volunteer or any other services. Do you have a phone number you can give us?
Yes, we'll offer our 24-hour 800 number. It's 1-800-ACS as an American Cancer Society 2345, and our website is www.cancer.org. And that's 24 hours a day, 7 days a week. If English is not someone's primary language, there are persons at our toll-free number who can plug them in so the information that they're trying to get can be conveyed to them. There's materials and resources that can be sent to them electronically via mail 24/7. So we have resources available, up-to-date comprehensive cancer information.
Okay. So you ladies have covered the gamut, okay? So that means no one can get around without saying, oh, I couldn't get it because it wasn't in my language, or I don't have a computer so I couldn't go online. So because, you know, people always say they couldn't get something or it wasn't retrievable based on the language barrier. I don't have a computer, I don't have television, something. And this way, by having volunteers such as Kimberly yourself and knowing that you can go out and speak to the community and, you know, make them aware of everything is a wonderful thing.
Yes, thank you.
It is. So we're going to take a commercial break, come back and talk about all these brochures and your upcoming event. And so we'll be right back in a minute.
This remarkable moment brought to you by your family. Isn't it about time?
Hands on your chin. I won, because I didn't say Simon said. You won.
From the Church of Jesus Christ of Latter-day Saints.
Hi, and welcome back to the second half of the show. For those of you who are just now joining us, we're here with the American Cancer Society, and our guest is the Executive Director, Donna Clark, and a volunteer of the American Cancer Society, Kimberly Batchelor Davis. Now, ladies, we left off with some very good information here, so we know we're going to ask you to come back because it's not enough time for us to get all the information out about the American Cancer Society and the various different programs that you have. But I do know that you have something coming up. So up under the umbrella, what is it, the Reach to Recovery Group? What is that all about?
Well, the Reach to Recovery Group came about as a result of a grant we received from Richard and Rhoda Goldman from their fund out of California. And Detroit is one of about a dozen cities across the nation who receive these grant dollars so that we can expand the Reach to Recovery program here in the metropolitan area to reach medically underserved women who are being diagnosed with breast cancer and giving them the opportunity to know that they are not alone and that there is a support system out there and that there is someone there in the community who can reach them and help them. So those fund dollars are helping us to do a better job in reaching reaching out to the community, by partnering with area agencies and community groups and such. So that's how the Reach to Recovery Advisory Group came about, to figure out how we can do the best job we can with the dollars we receive and to reach these medically underserved patients who are being diagnosed with breast cancer.
Okay, okay. Now for the month of May, I know you have a program that you're doing. So what is that you have coming up in May?
It's called the Mams, Moms, and More event. It's going to be held May 11th from 11 to 2. We're going to have live entertainment, refreshments. We're going to have our vendors who we've negotiated discount deals with. We're going to be giving anywhere from 10 to 50% off to anyone that participates in our Telefriend program. And the Telefriend program, what we're hoping that we can get people to come in and refer 5 people that they can talk to about early detection, which is going to get a mammogram, to just educate people on breast cancer health, making sure that people are following up and keeping up with what they need to do to keep themselves healthy. We are working right now to work with some of the sponsors that we have in making sure that we can bring Hugh Burrell of the Blue Pigs in to do some entertainment for us. Some of our sponsors are the Michigan Front Page, Verizon Wireless, KISS 102.7, St. John Health Center, and of course Eastland Center, who's been gracious enough to allow us to host this event there. Our biggest goal was that out of the Reach to Recovery group that we had talked about earlier was just to communicate with the different groups in the community that we were looking to educate about breast cancer, and to talk about what you need to do for early detection, what happens when a woman is actually diagnosed, and where the support networks are.
Okay, okay, okay. Well, we would love to attend that, so we'll mark our calendars for May 11th. Okay, and we hope that the public will give you a good turnout. I believe that, you know, young women as well as women in their 40s should be more educated in the areas of breast cancer, because cancer doesn't, as my mother said, this strikes old people now.
Right.
So people need to be aware that there's so many different forms of cancer, and you need to become knowledgeable and aware of how to self-detect some things that are abnormal with the body. You know, we don't want you to run to the doctor every day,
right,
but at least if you feel a lump or you got this constant pain, throb or something, at least check it out. And unfortunately, with medical coverage insurance, sometimes that's in question. You know, a person don't have Blue Cross Blue Shield or HAP and all that, and they say, well, I really can't afford to go to the hospital. But in my opinion, it's not always a hospital. Go somewhere, you know, where there's a free, every year, the city of Detroit always puts on Health-O-Rama, things like that. That is the best time to take advantage of a lot of the times when you want to go see about yourself physically. And, you know, and programs like the American Cancer Society seem like they offer all kinds of support, you know, for people to actually figure out what's wrong.
And the one thing that's really important too, we'll have a medical doctor there who will be giving a brief presentation on proper breast health, what's going on in the field of breast cancer as well, and will talk to us in layperson's terms. So again, if people have questions, they have an opportunity to hear from a specialist, a breast cancer surgeon, who can answer those questions. We'll have a breast cancer survivor who found her breast cancer 6 months after she had a clean mammogram, only because she did regular breast self-exams, and she's alive and well and beautiful today. And that's an opportunity for people to understand that they need to know their body. So whether you're a 22-year-old young woman, you still need to do breast self-exams and see your physician every year, every other year, to do a clinical breast exam. And again, if you're a woman 40 and over, you need to do those same things, as well as getting a regular annual mammogram. And that's American Cancer Society national guidelines. So the Mams, Moms, and More event is all about educating people, not just women, but the men who love them, about how breast cancer and proper breast health can potentially save the life of their loved one.
Okay, okay. Well, let's talk about some of these lovely brochures you have here on the table. We have Cancer Facts for Women. Okay, so if someone wants to get this brochure right here, anything in particular they find out about Cancer Facts for Women?
It's the primary cancers that affect women, so whether they be uterine cancer, cervical cancer, breast cancers, and again, the pieces here are just general overviews of these specific cancers. Fortunately, the American Cancer Society has several other pieces of material that can go into more detail about those specific cancers.
Okay. We got Cancer Facts for Men. Now, you know, a lot of men run from information. I mean, men will just take it on the chin and then say, I'm taking it with me, whatever it is. But we do know that there is some assistance out there for men. So basically, what would they find out?
There's information, of course, about prostate cancer, about lung cancer, about testicular cancer, which affects, testicular cancer typically affects younger men. But again, prostate cancer is affecting older men, and there are certain guidelines in there that relate to that.
Okay, and your brochure on the Cancer Society at work in your community.
At Work in Your Community is an overarching view of, just at a glance, what the American Cancer Society services and programs have to offer. And ideally, people want to know more specifically about something they're concerned with or want to get involved in. There's our number that's attached to that, but that's just a snapshot view of some general programs and services.
Okay. And making a difference in the community, so that must be your volunteer line.
As I mentioned earlier, the only way that the American Cancer Society can survive and has survived for more than 80 years is through our volunteer network. And this is a new piece that we've just put together, so if anyone is interested in volunteering, whether it's on an advocacy level, whether it's patient services, whether it's special events, this is a piece that talks about some of those particular activities and how they can get involved with the American Cancer Society by sending the information back to us on a postage-paid postcard.
Okay, okay. So, ladies and gentlemen, you don't have to put a stamp to this, but if you want to be a volunteer, just fill it out, send it back to these lovely ladies, and also, we always have to have do-goods. Got magnets for your refrigerator, or better yet, for your bathroom. Somewhere in the bathroom, this should be up, okay? Key rings to keep you posted, just in case. So there's phone numbers here. Donna, you want to give us those phone numbers again?
The American Cancer Society national toll-free number is 1-800-ACS-2345 or 1-800-227-2345, and then the website is www.cancer.org. And those two entities are available 24 hours a day, 7 days a week for the most up-to-date comprehensive cancer information.
Okay, okay. Well, you ladies are definitely most knowledgeable in this area, and you know, people should not wait till cancer affects them or their loved ones to be involved in such a program like this. You know, unfortunately, we lose family members time and time again over the years due to various types of cancer. And ladies, we're trying to get you to understand, don't wait till the last minute to check yourselves out. Men, don't wait till you just can't take the pain anymore. You know, go see about yourself. Make sure there's nothing there. And I think you'll feel more relieved when you actually check yourself out and say, glad I went.
Exactly.
Okay, okay. And when you have volunteers like Kimberly, you know, people who want to involve themselves with services for the community, it's a wonderful thing, because a lot of people don't have to be sick just to be involved in a service. Okay, so that's what makes volunteering a wonderful piece of society, when you're not sick and you're involved in something, you know, or it doesn't necessarily have to be something that happened in your household. You could just want to give back to the community, like she said, and that's an added plus when you want to just give back to the community. So whatever agency or program a person want to be involved in, they should do their best to become, you know, active in that services. And it's just great. It's just great. I do want to ask you ladies to do come back again. We'll try to make it a date to be out there on May 11th. Okay, at Eastland Mall?
Yes.
Okay.
Upper Woods, Michigan.
Okay, and the name of the program will be?
Mams, Moms, and More.
Mams, Moms, and More. Okay, so the children should come, the mothers, the husbands, the boyfriends, all those should be there.
Everybody. Just
to get an understanding for sure of what the type of services are available and have some fun.
Exactly.
And everyone has an opportunity to potentially save the life of a loved one.
Right.
And that's the overarching message with the Mams, Moms, and More event, that it doesn't matter how old you are, everyone can have an opportunity to save the life potentially of someone they love and care about. And that's the message we're trying to get out.
Okay, well, you delivered a wonderful message. You know, and before we go, we got to get close up at this beautiful pen that Donna has on. I was just complimenting on the pen. That is not a regular pen. That pen that you're wearing is what?
It's for Tell a Friend, and as Kim mentioned earlier, it's about the program we have that we work with the community and volunteers to really reach women 40 and over, and spreading the message about early detection and that mammography when you're 40 and over is best every single year. And the wonderful thing is we have a special present for you, Marcia, just for inviting us on the show. And it is a replica of my pin, which has the Telefriend logo on it, which is of 3 women looking like they're whispering in each other's ears, telling them that I care about you and I want you to take care of yourself, and please get a mammogram every single year, especially if you're 40 and over. And then on the back side, it has Mammography Saves Lives, Get a Mammogram, and tell a friend, the 1-800-ACS-2345 number. So this is our thanks of appreciation for allowing us on the show, and this is your opportunity too to make sure you tell a friend and participate in the program with us.
Okay, thank you very much. I'm going to wear this shirt with pride, and I'm going to get my very first mammogram. Okay. Okay, well, ladies, please, Donna, Kim, thank you so much. Thank the American Cancer Society for having you join us. Okay, and please come back.
Thank you.
Thank you.
Well, ladies and gentlemen, this show touches me deeply. Cancer affects a lot of people's lives, my family, your family, and friends. So we want you to support the American Cancer Society by being present at the May 11th event at Eastland Mall. Also, if you want to become a volunteer, please check out the website number or the phone number that the ladies were so nice to give out. Any programs that you want to see, give us a call here at Just Ask. We work for you. And give us a phone call, send us a letter. We'll be happy to forward some of these brochures, key ring, refrigerator decals, reminders of services that are available. So please give us a call here at our Just Ask hotline, 248-988-0250, 248-988-0250, or catch our address at the end. Well, you know who I am. I'm your host, Marcia Florence, and what do I always say? If you know someone with a disability, don't be afraid to ask. Just ask. I'm your host. Thank you.